Welcome to the Read, Talk, Grow podcast, where we explore women's health topics through books. In the same way that books can transport us to a different time, place, or culture, Read, Talk, Grow demonstrates how they can also give a new appreciation for health experiences. Books can provide understanding of health topics and provide a platform from which women's health can be discussed. At Read Talk Grow, we're using books to learn in the hopes that we can all lead happier, healthier lives. I'm your host, Dr. Denise Milstein. I'm an assistant professor of medicine at Mayo Clinic, where I practice women's health and integrative medicine. I am always reading. I love discussing books with my patients, my friends, my professional colleagues, and now with you. Our book today is Delicate Condition by Danielle Valentine. Our topic today is infertility and pregnancy complications with a bit of a twist. I'm so excited about our guests. Danielle Valentine is the New York Times best-selling author of books for adults and teens, including the Barnes & Noble YA Book Club pick, Two Sides to Every Murder, and Delicate Condition, which was adapted by Ryan Murphy into American horror story Delicate, starring Emma Roberts and Kim Kardashian. Danielle is also the author of the Merciless series under the name Danielle Vega. She lives outside New York City with her husband, daughter, and two ornery cats. Danielle, welcome to the show.
Thank you so much for having me. This is quite an honor.
Our expert guest is Dr. Alessandra Ainsworth. She's an assistant professor of obstetrics and gynecology, specializing in reproductive endocrinology and infertility. She completed medical school at the University of Kansas and both residency in obstetrics and gynecology and fellowship in reproductive endocrinology and infertility at Mayo Clinic. During her fellowship, Dr. Ainsworth obtained a master's degree in biomedical science. Her clinical interests include infertility, fertility preservation, premature ovarian insufficiency, recurrent pregnancy loss, assisted reproductive technology, and in vitro fertilization. Allie, welcome to the show.
Thank you for having me. Happy to be here.
Well, this is a new one for Read Talk Grow. Delicate Condition is a brand new, whole new genre for me, something sometimes called pregnancy horror. Anna Alcott is a newly famous actress who's been receiving fertility treatment along with her husband, Dex. We meet her as she's in the middle of a cycle of IVF, in vitro fertilization, and becomes pregnant. When she's diagnosed as having a miscarriage, she continues to feel and have her body respond as though she's still pregnant, but something is still off. All right, Danielle, talk about this genre. What is this, and who is the reader you picture reading this book?
So it's so interesting that this has now become a genre. When I was first writing this book, it really just came from a place of I'm a horror novelist. I've been writing scary books for teens for over a decade. That's what I do when I need to kind of process something difficult, is I turn it into a horror story. And the idea for this book came out of my own pregnancy journey. I was starting to talk with my husband about wanting to have children. We attempted to get pregnant. It took longer than we expected. And then when we got pregnant, I suffered a miscarriage, which was devastating and hard and weird. And I just couldn't go back to writing scary books set at prom right after that. I needed to write about what I was going through and what I was experiencing. And I got my start writing these fairly gruesome body horror novels. And I honestly can't think of anything that fits more within the body horror genre than pregnancy. Shortly after my miscarriage, I got pregnant with my daughter. And even that experience was so gruesome, so weird, so surreal. And the entire time I was pregnant, I just kept turning it into a horror story in my mind. So this is kind of a long, drawn out way of saying that the audience for this book was me. I wrote the book that I wish I had had while I was pregnant. So many of the books that we give to women who are pregnant are happy, showing this really rosy, sunshiny view of pregnancy. And that's not the reader I was. I needed something that felt like I felt on the inside, and I felt pretty weird. So I wrote a really weird book. And I think there are other women out there who need a weird book while they're going through this. And I hope they find it. I hope they enjoy it. So that's really where this book came from.
That is so insightful, and I hope they find it as well because people need different forms of telling story, especially as they're
Absolutely.
processing. But to hear you talk about framing it as part of your own healing for your journey and your loss, and I'm sorry for your loss with your
Thank you.
miscarriage. Allie, I'm sure this is new for you too. Tell us your reaction to the book and also tell our listeners what it's like to work in a fertility practice.
Yeah, I think, Denise, I had a similar reaction to you, which was I've never heard of this before. Me as a person, I don't read, I don't watch any scary anything. I did Danielle read your book and I sat in a corner so that that blue ball cap with the glasses was not looking over my shoulder. But
That's
it
fair.
it does add a whole new layer to know that this came from your personal experiences. The question of what it's like to care for women, I often tell people when I first meet them in the infertility clinic, I'm happy to see you and I'm really sorry that you're here, right? There are
Hmm.
some parts of life that we're happy to engage in. And another thing I tell them is often what started as a fun endeavor isn't fun by the time you're here,
Yeah.
right? And that could be getting pregnant the first time. That could be getting pregnant after a pregnancy loss, an infant loss, right? There's so many life experiences that come with our patients into the door. So it is hard, right? In
Mm.
many, many ways to go through this, to go through infertility treatments, to go through pregnancy. So to hear that horror in a way, Danielle, is how you process is new, right? We hear new things all the time from our patients. You're not my patient, obviously, but a new spin on how to process these. So yeah, happy to talk more.
Well, and I think you're right, Danielle, that we see even not just in books and movies, but we see pregnancy portrayed in this highly romanticized, glorious,
Hmm.
beautiful, loving time. And it is a miracle and it is wonderful. And it does have its moments, but if that's the only side of it that's being told, there's a lot missing. And I think it has women wondering if they're the only ones for whom their pregnancy wasn't perfect. I love your dedication for the book. It's for everyone who's experienced pregnancy, child loss, infertility, or labor and for the people who believed them when they said it hurt. It's just so powerful and beautiful and meaningful dedication for a horror novel, Danielle.
Well, I often tell people, so I've been in this genre for, God, since I started writing in my early 20s, I've been writing horror. And you meet a lot of people who say exactly what Allie said, that I don't read horror. It's not my genre. I am too scared. And I like to tell them it's an acquired taste. It's like I don't eat spicy food or I don't drink coffee. You would like it if you learned how to read it and how to process it. It's challenging and it's not intended to make you feel comfortable, but I truly believe that there is an access point for everyone for horror. I say this very confidently because my husband hated horror. And when we first got together, would not read any or watch anything that was scary. And I have slowly taken him to the dark side. And now he will admit that there is something there that he enjoys. So I kind of got started reading and watching and listening to it at an early age. So I kind of got, grandfathered in, I guess. But I think it's important. I think it's an important way for people to process pain, especially for people who maybe aren't processing it the way that's more socially accepted, just crying and being sad. It can be easier to access that grief through horror, I think.
I just think there's so much wisdom in this, and I'm so grateful we're having this conversation because when you read horror, you are promised something. You are
Hmm.
promised that you will be uncomfortable and that it is not real. And so that does allow, in many ways, the writer to get to darker aspects of the story, where if it was contemporary fiction, for example,
Hmm.
you might be called out for being too graphic or
Yeah.
too much. And in horror, there almost is not too much. But let's talk about Anna. So we know there are going to be these uncomfortable scenes in the book, but we
Hmm.
start with Anna nearly missing her egg retrieval procedure.
Hmm.
As a reader, I literally felt anxious from the get-go. And I was wondering, Danielle, if that was intentional to kind of introduce the reader early on to say, you're going to be uncomfortable in this
Yeah.
read. So try the first few pages, and if this isn't for you, the rest of the book maybe isn't going to be for you.
Yeah, that was definitely intentional. When you're writing horror, you really want to establish the tone of the novel as early as possible. And usually that's before anything really scary has happened. So any small thing I can do to set it up to make it clear that like this is going to be something that is going to challenge you a little. This is going to be something that makes you uncomfortable. I'm working on doing in the early chapters. Beyond that, though, I really wanted to make a comment about the hoops that women are required to jump through to get pregnant, to perform this miracle. You mentioned earlier that it was a miracle, but it's a miracle that women make happen, that women are actively working toward, and it's a messy miracle and it's not easy. And I wanted to set up from the first page that it is not easy. It is not something that just happens beautifully for every woman. There are a lot of women, there are a lot of people in this world who have to work very, very hard for the possibility that this might happen. And I really wanted to make that clear from the first page.
Yeah, I think that's such a great point. And maybe Allie, you can tell our listeners even what is the egg retrieval, which is what Anna, the main character, is preparing for at the beginning, and how that's not something you just put on your calendar and show up for. There's a lot of preparation that happens before that.
Yeah, so the egg retrieval is one of the major endpoints of an IVF stimulation cycle. So Danielle, to your point in burden of care, right?
Mhm.
An IVF cycle, on average, 10 to 12 days of injections, 2 injections initially, then 3, but during that time, monitoring by blood work and ultrasound is extraordinarily disruptive to life outside of the IVF clinic, especially for patients who live a few hours from their fertility clinic or a center that has access to this type of monitoring. It becomes a full day event. So at the end of those 10 to 12 days is the egg retrieval done under anesthesia. We call it conscious sedation. So I describe it to patients that they are asleep but breathing on their own. And as you mentioned, Denise, really precisely timed to the degree of take your last injection at 9 p.m. on this night, and 36 hours later at 9 a.m. is your egg retrieval. So there is, maybe an hour window, but it really is critical because outside of that hour, we risk premature ovulation. So those eggs being released into the body before we can actually retrieve them in the egg retrieval process. And without that, right, all of that time and effort and money is lost. So it is very precise and extraordinarily burdensome for the patients who go through this.
And in that first scene of the novel, Anna has her day planned to the minute. She's getting ready. She's got a friend to take her to the clinic, and she gets this panicked phone call from her husband to say she's late. She was supposed to be there an hour, and it's devastating because, like you said, she's had injections, she's had appointments. She's been looking for this as a key point to keep moving the process forward. Danielle, not every woman having fertility treatment is a movie star, but many women who have IVF are living very busy lives. And you put Anna into that rhythm of needing to choose between appearing on things that were important for her professionally and going to work functions versus being available for some of these processes. Can you talk about that messiness of the process?
Yes, I would love to. So, when you're working on a novel, you often try and come up with a character who is the worst person to put in this situation. So, you're trying to come up with, okay, like who is the person who is going to be challenged the most by the situation that I'm creating? And I couldn't think of anyone who would have a harder time than someone who is like quite literally in a spotlight, who is being watched all of the time, who's famous. When I was going through my miscarriage, I remember there was a Hollywood some star. I want to say it was Shay Mitchell, but it might not have been her, who was similarly going through pregnancy loss. And she had to like post about it on her social media and basically make it clear to fans who had been following her journey what had happened because it was public. And I remember thinking at the time that I couldn't conceive of anything more painful than having to publicly talk about something so difficult at such a vulnerable, raw point of my life. So that's really where the Hollywood star actress part of it came from, is this idea that you have to live through the most painful thing you've ever been through, and you have to do it publicly with an audience. Beyond that, one of the things that I experienced, I was getting pregnant and having my first kid in my late 30s in New York City, and all of the rooms that I walked into, whether it was prenatal classes or new parenting groups or whatever it was, I would hear the same fears being spoken of again and again by the women around me. And it was, I don't know how to stay myself, how to stay true to all of these goals I had before I had a child, and also be the mother that I want to be. It was this constant tension between those two things. And I definitely felt that when I was having a child. And so I really wanted that piece to be part of it as well, which is another reason I thought, you know what, actress is really good, because you have this tension, you have this struggle of, I spent my whole life building this career. It's important to me, but I also want to be a mother. And we tell women that they don't have to choose now. And to an extent, that's true. But once you are faced with the everyday challenges of trying to be there for your child and trying to be there for your work, that is something that didn't just go away. And so I really wanted to talk about that as well and to bring that into the novel. It's a complicated issue, but I very much wanted that to be present in the pages. That's what went into creating Anna's character, those two very real tensions that I felt.
There's just so much in this novel. There are
Thank you.
so many components of women's health and what women navigate. You mentioned, almost even as an aside, in one scene, there's this division between women who have children and women who don't have
Yes.
children as a very defining factor. I don't know if either of you want to comment on that. I'm sure you both have thoughts.
I'm like still thinking about everything you said before and how maybe Denise, we come back to this, but this person in the spotlight is not only going through their own process that often carries with it unreasonable, like inappropriate shame, meaning not
Mm-hmm.
that that person had an inappropriate response, but the way society makes women feel to have
Yeah.
shame and isolation, and that this is not common, that we don't talk about this, right? Is like still where my brain is from before. So I'll let you take a first pass, Danielle, at Denise's question.
Well, I think that just before we even get to that, I think that that's such a smart insight to bring up, because yeah, there is this feeling of shame or of having done something wrong. I remember when I went through my experience, this woman, one of the nurses, said something to me, and I don't think she meant it to be shaming. I don't think that was intentional at all, but it stuck with me. I had had a wedding that was coming up right before I had my miscarriage. And I remember just asking, just like, okay, am I going to be okay to travel? And I have this wedding. And she made a comment where she was like, we don't want more people to know about this than have to, essentially. We don't want you to have to pull out of this wedding and tell people why. And it was just an aside, like a small comment, but I just remember being like, I told you that this was one of my best friend's weddings. Why would I feel shame about telling her that I was going through something so medically traumatic? It was almost as though I just was struggling with, like, wait, am I supposed to feel more ashamed about this than I do? Because it was so strange to me that she would say that. And it's just these small, small things that people say. And again, I don't think they mean anything by them. I don't think that they're intending to make you feel bad. But when they layer and they add up, and it ends with women feeling like they shouldn't be talking about these things, or that they should feel bad about what had happened for reasons other than just their grief that they lost something they were so excited for. And that was definitely present when I was writing the book. Yeah, it was definitely something I thought about a lot.
And that it compounds what almost all of my patients are already feeling themselves, right? So when I see someone with a recent pregnancy loss, I every single visit say, if you have not heard this before, I want you to hear my voice in the future, that you did nothing
Thank
to cause
you.
this. There's also nothing you could have done to change this, which is both freeing and heartbreaking in the same moment. And then to say, are there things that you're holding on to? Is it that
No.
you did exercise or you didn't exercise, that you slept on your back or you didn't? Let's clear the air, like easy to say, hard to take to heart. But those little comments, Danielle, add to what we as mothers, future mothers, right, women are already doing to ourselves. And then to
Yeah.
hear that from people in healthcare and positions of power, whatever that may be, is kind of an added layer to all of that.
That is incredibly true. That is incredibly true.
Well, and I think this is an overall comment on the culture of healthcare directed at women, that we do have a tendency systematically to blame people for what happens to them, or as women, we've been raised to think, what did I do wrong to cause this to happen? So Allie, that's such a beautiful way to approach particularly miscarriage. And Danielle, for your experience with your miscarriage and this healthcare professional, this is part of the reason we created Read Talk Grow, was around miscarriage, and nobody talks about it.
Nobody talks about it.
It's really unclear what are you supposed to do. You're just supposed to kind of silently go through it, pretend nothing's happening, and go back to work. Allie, what did you think? This is getting really far in the book, and we're going to come back, I promise. But what did you think about the scene where, for our listeners, Anna, the character, has what she believes and is told is a miscarriage? I thought it was a really excellent depiction of one way that can happen.
Yeah, I think that's another way that often, right, some of the healthcare providers that are providing the counseling on what we might expect for miscarriage have never had a miscarriage, which doesn't mean they can't provide that care, right? But to say, in some scenarios, it's going to be like a heavy period. It might be, it also might horrifically not be, right? And to have any kind of guidance on, I am already like outside of my body in a way, right? So like my perception of what is happening is different because I am grieving. When am I safe? When am I not safe? Like what is normal and not normal is a pretty wide spectrum related to miscarriage, right? So to not be able to say those words in a patient language that is meaningful to them, I think is part of the service is maybe too strong of a word, but maybe area that we as the medical community could do better in terms of miscarriage, both about physical symptoms and emotional, right? These are normal things that people go through. It's not just you. And also, how can we keep you safe in multiple ways through this process?
That's so important, and it's so helpful to hear that it's something that even medical providers struggle with. When I went through it, really one of the biggest reasons I wanted to write this book is because I went through this miscarriage. It was very difficult. And I remember thinking afterward that every single depiction I saw of miscarriage on television, in fiction, in movies, anywhere, it wasn't my experience, and was also the same. It was always this, like a woman would fall or she would scream, and then in the next scene, they're like, oh, she lost the baby. And it was that quick. And that was what really bothered me. It was just the fact that it was so fast and that they immediately seemed to know what was happening. In my experience, it took about 48 hours before before anybody even said the word miscarriage to me. And everybody was just basically like, calm down. That was the message I was getting over and over and over again, is it's fine. It's just a little bleeding, calm down. And even though I knew that it wasn't right and I could feel that something was wrong, I was really not. And I understand why people do that. I understand that it was, intended to keep me from getting upset when we didn't know what was going on yet. It kind of had the opposite effect. I'm somebody who likes to have all of the information and likes to just be told really upfront what the possibilities are. And so I felt like I was not being treated like an adult. But even the actual scene where she's at the hospital and she has the miscarriage, that was very much taken from real life. It was important to me to have what I felt was a more accurate depiction of that in fiction. And of course, when I was writing it in my wildest dreams, I'm like, I would love to see this someday on a screen depicted a little bit more, just a little bit messier, just a little bit more like this is kind of what it feels like. And so it is very surreal to now, I can now go watch Emma Roberts recreate I accept experience on American Horror Story, which was not really ever what I was expecting, but was kind of an interesting result of writing this. So now we do have what I feel is a little bit, at least more accurate to my experience. As you both mentioned, this is every woman's experience is very different. But now we at least have another one that we can look to, I hope.
we can transition from talking about miscarriage. I just want to mention that in a prior episode, we talked to Jackie Polzine, who wrote a book, Brood, about a year in the character's life after she'd had her miscarriage and the grieving process. And to your point, these losses are to be grieved, and they are not these one moment kind of get over it, which is, I think, the story that we're sold, that women need space, people need space to process when pregnancy loss happens or when complications happen. Let's talk about the fertility process. This is a large part of the early part of the novel. So she's missing appointments. Anna's forgetting to put medications in the refrigerator, which are critical that they be refrigerated. She's missing calls from her doctors, which is out of character for her. This is somewhat common that will say, oh, it's pregnancy brain, or you must be forgetful now because of your hormones. But in fact, this is gaslighting. But can we talk a little bit about that tension with how we treat women when they're going through treatment or when they're pregnant in regards to that?
Yeah, I mean, this theme throughout the novel was really inspired by medical gaslighting and this experience that many women have, and many women often have for the first time during their pregnancies, of not feeling like people are taking their concerns about their own body seriously, of not listening to them when they're saying, this is painful, this hurts. I was very lucky that I was surrounded, for the most part, by very responsible, intelligent, kind medical providers. But every now and then, there would be somebody who just kind of discounts the things that you're saying about, or the things that I was saying about what was concerning, what I didn't understand, what I needed explained more. The miscarriage was obviously like a big moment. I felt like I had told many people something's wrong and was told it's okay, it'll be fine, it'll go away. If the bleeding's not this heavy or the pain doesn't feel like this, etc. These kind of statements. And then throughout my successful pregnancy, I would often, just the way that the pain is kind of minimized was something that I remember very clearly. Starting with my D&C, the procedure right after I had my miscarriage, was told, oh, it will just be a pinch, it won't hurt. And then the pain was so bad that I nearly passed out. And then moving on into my successful pregnancy, just very common, you would get this kind of a statement of like, oh, it won't hurt, it'll be a little uncomfortable, these kind of words to describe what ended up being excruciating pain or extreme discomfort. And again, as somebody who just really appreciates people being upfront with me and having all of the facts so I can prepare myself emotionally and mentally, I felt really gaslit often about some of these things. And yeah, it was stressful. And so that kind of led me down this rabbit hole of learning about the history of women's health and where this comes from, why we do this, and that I think medical providers are often trying to overcome, or at least the really responsible ones are often trying to overcome. So it just was such an interesting theme, and there was so much there that I really wanted to dig into with this.
I would say some are trying to overcome it, and more often people aren't even aware of it because it's
Yeah.
so much a part of our culture. Allie comments about how women are believed when they go through care.
Yeah, I was thinking about, on the provider side of all of this, there are times that a patient is experiencing something that is new to me. That
Mhm.
doesn't mean it's not true, but it sometimes means I don't have a reason. I can't explain it to them, which is can be uncomfortable, right? We're kind of used to this doctor-patient relationship that the doctor should know the answer to everything, and for both the provider to admit, I don't know, and for the patient to accept that answer as an educated and honest answer, right? There's a bit of tension there on both sides of that relationship. So
Yeah.
early pregnancy bleeding doesn't always end in miscarriage. And to say we don't know what will happen, right, is both honest and not at all reassuring or satisfying to
Mhm.
hear. And then in regards to pain, right, I had a patient a few weeks ago who was describing pain after surgery. And part of our conversation, I'm probing all of the things, all of the categories that I know could be true. And there probably is one that explains it. But also, to be honest, I don't know that I have a perfect explanation for this, right? So let's try this. But that takes time and input and, ongoing conversation from both parties which isn't always true for a variety of reasons, right?
I think patients would like to think that we always have the answer, but really often you're getting an opinion, experienced opinion, but you're very often getting an opinion. Allie, can you talk a little bit about the fertility medications? I'm really trying hard not to spoil the book. So that makes it hard to go into the middle and certainly to the end. But just the injections, the mood swings, the bloating. We see another character doing injections who has bruising of all different ages. Can you talk about the medications generally, not specifics, but what women who might be going through fertility could expect, or if somebody is thinking about somebody going through fertility, understand what that woman's navigating?
Yeah, I think first to say that when we're talking about these injections, we're mostly talking about in vitro fertilization or IVF, right? So there are oral medications that have their own side effects, but focus to this conversation. I often tell patients that in the first 8 days of those injections, and a reminder that 10 to 12 is an average, but not a requirement for the length of time, the physical symptoms are less so because the ovaries haven't grown as big as they will. So bloating often starts around day 8, but admittedly, everyone is different. Everybody's ovarian reserve, how many eggs they have, how many eggs will grow is different. Body habitus are different, right? But later in stimulation, people describe more physical symptoms, that feeling bloated, full, just kind of blah, like very much not themselves. Prior to that, it is more pain with injections. There are certain types of injections that kind of burn more when you inject them than others. They're subcutaneous injections most often, which means a small needle often injected into the abdomen. Many times, almost always, but not quite, when we see people for their egg retrieval at the end of all of this, right, there are multiple bruises across the abdomen from those 2 injections, maybe 3 injections or more a day. I think the mood symptoms are really different across individuals. Most of my patients continue to work, which may only be credit to what they're working through, but I mean by that, I don't at least have the sense from them that it's so disruptive that they can't do what is expected of them. Again, a loaded statement to a degree. But some people do feel extra sad, extra irritable. Some people feel pretty good actually having high estrogen levels. Female bodies, as an oversimplification of that word in general, like estrogen compared to progesterone, for example. But I think a wide variety of symptoms is not uncommon, meaning each patient doesn't have the same experience throughout this. But I think the physical part becomes more noticeable in the latter half of those injections and doesn't resolve on day of egg retrieval. It takes a week or two for the ovaries to shrink back down, which is, I think, sometimes surprising. That I think day of egg retrieval, my life is going to be better. I'm going to have eggs on the outside. My symptoms are going to be over. And it's still a long road when you think about embryo development, resolution of the ovarian follicles, them shrinking back down.
It strikes me like the way you're describing it, it's so extreme what is done to the person's body when you prepare them for this egg retrieval that the body needs to recover from this incredible physiologic or super physiologic stress. Okay, Danielle, make some comments about events happening during the course of pregnancy that aren't expected, because we've said all women probably have some surprises in their pregnancy journey, not necessarily of the kind that Anna has to navigate, but will you just comment about that in the book and how important that was when you were writing it?
Oh, happily. This is really what kind of inspired the book to begin with, is becoming pregnant and realizing that it was quite a bit more gruesome than I was led to believe. So throughout my pregnancy, the symptoms that really shocked me, there were the smaller ones. So the fact that I would struggle to breathe. I didn't realize that what I read, I feel very overwhelmed talking about this with doctors. And sure that I'm going to say something incorrect. From what I read, it's because the child is growing, so the fetus is growing so large in your body that it's crowding your internal organs. So lung capacity is less. So I had a really, really hard time breathing starting from about 6 months on. That was just very difficult. My fingernails were weaker and drier and would often like split. My gums would bleed. Other parts of my body were extremely dry to the point, and I have dry skin anyway, just to give you way too much information about my own body. But so I already have dry skin, and my skin would become so dry that my hands and feet would crack and bleed, particularly as I was pregnant during the winter. And all of these things, you look it up online, you're like, is this normal? And at almost any symptom, if you look it up on Google, which you're not supposed to do because it's actually quite horrifying, but you look it up on Google and somebody's just like, oh yeah, that's totally normal. You know, the baby is basically seeping your own nutrients to grow itself, and your body doesn't care quite so much that you have enough to keep you healthy and safe. Or at least that's what Google told me. Again, feeling very overwhelmed talking to doctors here who can tell me immediately all of the ways in which I am incorrect.
But Danielle, I think to normalize as an OBGYN, when I was pregnant with my first daughter, I was also Googling, right? Like I knew
I love that.
about preeclampsia and all of these other things, but like the smaller details that impact our day-to-day lives as pregnant women can't be covered in a 15-minute prenatal
It
visit,
really
right? So
can't.
it was
Really
also new
can't.
to me. Like, is this normal? Oh, yes, it is. Yeah.
Are my eyes supposed to feel dry? Like, are my eyes
Yeah.
supposed to hurt inside of my skull? That seems odd. But yeah, no, it's not. It's very normal. And so there were lots of small things like that that then ended up in the book in more hyperbolized ways that just shocked me. And I was just like, oh, that's normal. That's what we deal with. So it was, yeah, it was a journey.
It's a big job to make a new person. So it
Quite
does
a big job.
pull from your own resources, whether that's the nutrients that used to go to give you strong nails. I think only a horror novelist would describe that as the baby seeping those
Yeah,
nutrients from you. I think Allie probably describes
possibly.
that
A little
differently.
bit different, a little bit different.
All right, so I want to not spoil the book. I'll say that again, but talk about the ending because I do think a major theme of this book is the importance of women supporting women and coming together to embrace a woman who's going through fertility. I felt quite hopeful at the end, even though a lot of things happened to Anna and her family. But we just comment about the importance of women supporting other women and having friends, whether you're going through fertility, pregnancy loss, and even healthy pregnancy, birth of a child, just how important that is. I just want to hear from both of you.
Well, I will say that after I had my daughter, you kind of find a new group of women, of people who have also had children, whether that's through just meeting people at, daycare pickup, or if you actually do a, mom's group. I moved to a new neighborhood and there was a huge community of women already here who had children the same age as my daughter. And this thing just happens where you get together frequently enough and then you start talking about your own experiences and what happened. And I just noted that every woman has a story about their pregnancy, their birth, and how it affected them, and that they hold with them even after their kid is born and is getting older. So I would just kind of collect these stories of women who had been through it, and many of the stories were far more horrifying than my own, were interesting in a different light, and that kind of led me to reading about other just historical stories about pregnancy, which is, you'll see there are little sections in the book talking about other people's experiences with pregnancy. And I thought that was really important to include because my experience, Anna's experience, is not the only experience. It's not even the dominant experience. It's a experience. And I wanted to make it clear that lots of people have different experiences. So yeah, like just being surrounded by those women and hearing what they've been through, and like seeing the ways that we all try to come together to support women as they go through difficult things, and women and anyone who can give birth. It just made me feel really hopeful that there are these communities that exist and they are important and they're necessary for continuing to bring children into this world. That labor is really important. We talk about birth and pregnancy a lot as a miracle, but it's labor. It's the labor of women, it's the work of women. And that work, the work of coming together to support women who are going through it, is just so incredibly important. So again, without spoiling the book, I don't know that I can talk a little bit more about some of the twistier things that happen without really giving things away. But that was what really inspired me, is the idea of women coming together and the village that we form, that we are able to be a part of if we're very, very lucky to find a community that comes together to help you through it.
And that was one of the reasons I knew we had to talk about Delicate Condition on Read, Talk, Grow, with how it comes together. Okay, Allie, tell us.
As I listen to you both talk, to me, pursuit of pregnancy, whether it ends in parenthood or not, right, is such a transformative experience that, one, both changes you as a person. And I think, at least for me and for many of my patients, when you walk into this, many people have had adverse events in life, but also for many, this is the first adverse event. And it is messy, and there is grief and joy and hope amidst all of this, right? But I think in that process, there emerges for many a more openness, whether that's with their healthcare provider or their friends or their family than they started with. And you could think of this in I have very dear friends that are not parents, and we connect through other transformative experiences, right? But specific to women's healthcare and pregnancy, I just think how much changes for you as a person allows you maybe to be more open and more receiving and participating in these deep female friendships because of everything that you have both gone through and kind of who you have become, changed, who you are changed as a result of all of that.
How beautifully said. Danielle, as I mentioned, there's so much to unpack in this book. I think we could have a whole women's health conference just focused on all the lessons in your book. Congratulations on the success. It is really remarkable and a completely different shift in looking at fertility and pregnancy experience. Thank you for writing Delicate Condition, and thank you both for being on Read, Talk, Grow.
Thank you. Thank you so much for having me. This was such a delightful conversation.
Yeah, thank you. And my first horror novel is checked off the list, so happy to be here.
Hopefully it's opened up the door for a new genre. You'll go seeking them out now.
Maybe. Read, Talk, Grow is a product of the Women's Health Center at Mayo Clinic. This episode was made possible by the generous support of Ken Stevens. Our producer is Lisa Speckhard-Pask, and our recording engineer is Rick Andreessen. Visit our show notes to see the books discussed today and for links to other health education materials. Follow us on social media like Instagram and Facebook, or reach out directly to our email, readtalkgrow@mayo.edu, with suggestions for books or topic ideas. We'd love to hear from you. This podcast is for informational purposes only and is not designed to replace a physician's medical assessment and judgment. Information presented should not be relied on as medical advice. Please contact a healthcare professional for medical assistance if needed for questions pertaining to your own health. Keep reading, everyone.